Dr. Lara Briden, welcome back to Women's Wellness Radio.
Hi, Bridget. Thanks for having me.
Yeah, I was just trying to get think about the timeline when you were last here. When was that?
It was a couple, 2 or 3 years ago, maybe. It was just after my first book came out.
Yeah, so we're here. If you're on the video, I'll hold up the book. Lara just published the second edition of her book, Period Repair Manual, and we talked about it the first time a couple of years ago, for sure. Yeah, or more. This time the book's like twice as big.
I know.
So what's in there that's new? Probably a lot, but how would you sum it up?
I expanded it, especially the PCOS and endometriosis sections. I added a whole new chapter about perimenopause, which I think we'll be talking about today. I added more than 300 new citations. It was just,
I noticed you had a lot of citations.
Yeah, well, I think part of it was in the last couple of years, there's been a lot more interesting research about things. For example, there was the big study about the pill being linked with depression, all things like that. I really felt like that had to go into the book. And this book has some insights and quotes from Professor Geraldine Pryor, who's an endocrinology professor in Canada, who's one of my heroes. And so she actually helped me with the book and gave me some fact checking and tips. And so I think that made it an even better book. I was excited.
Oh, fun. So I'm curious, what was your feedback from the first book? Like, were people like, oh my gosh, I didn't know anything about my period?
One of my favorite reviews on Amazon, which I still remember almost word for word, is like, why did nobody ever explain this before? I think some of the basic things like, first comes ovulation and then you get your period. And, I know for a lot of us, of course, for in our circle, we know that, but there are a lot of people out there who don't seem to know some of the real basic things. And I'm glad that I think it sounds like I must have made it fairly user-friendly that, everybody could just feel like they could understand how the cycle works.
Good. Yeah, it's super, super important. And then we're going to, focus today on perimenopause. We'll define that in a minute. Some people listening may know about that because I last summer did a whole event on, but I didn't call it perimenopause because as you said in the book, most people don't know that term.
Yeah.
So I just called it hormone balance after 40. So let's start with like, what is perimenopause? How do you define it?
It is the hormonal changes that happen in the 2 to 10 years leading up to when our periods stop. So
okay.
It really varies. Some women sail through with no symptoms. Some women have quite a few symptoms. I think the estimate is about 20% of women will have quite intense symptoms during that time. It's changes with mood, changes with periods. Periods can become quite heavy, which is probably one of the biggest problems. It's kind of like a second puberty, if you will. And we don't often, I think we're not expecting it because society doesn't talk about it. We know that, during puberty, teenagers are going to be moodier and have physical symptoms they didn't expect. But the same thing can happen in our 40s.
Yeah. I mean, my mood has definitely, like, just reading this chapter, like, reinforced a few things that are going on for me right now. I was like, yes. So I want, you had a list of like, you'll know you're in perimenopause if a few things I picked out of there. If you're starting to wake up in the middle of the night, if you're starting to have migraines for the first time, or gaining weight for no apparent reason. So maybe tell us, like, why would these symptoms come up?
I think the biggest factor is the loss of progesterone. Like I say in the book, progesterone are wonderful, calming, stabilizing. Progesterone just quietly exits the scene. And that happens if we stop ovulating every cycle, which is common in our 40s. And also, even if we do ovulate, we're not making as much progesterone as we used to in our 30s. That's just true for everyone. It's not necessarily something that someone is doing wrong. And the reason it affects mood so strongly is that progesterone itself is a calming hormone, but also it helps to kind of calibrate and stabilize what's called the HPA axis, which is the adrenal axis. So, we talk a lot about adrenal fatigue, and in our 40s, we're in a vulnerable position for that because we've lost progesterone's beneficial effects on our adrenal health or our HPA axis.
Okay. Yeah, that was something from your chapter that really stuck out to me. So, and I know, I think when we had Dan Kalish on the, the summits and podcasts, he talks a lot about, so the brain uses these sex hormones to communicate, I guess you could say, and relay messages. So as these hormones of our reproductive years lower, the brain just sort of like, or the endocrine system has to recalibrate and find new ways to operate. Is that somewhat
For sure.
true?
Yeah. Both estrogen and progesterone have a powerful effect on the brain, a hugely powerful effect on the brain, which is, of course, I'll just refer again to the supposedly groundbreaking study about hormonal birth control causing depression, which, I guess to some scientists was kind of surprising, but really is not that surprising when you think about how much steroid hormones affect the brain. So in the case of our own natural hormones, estrogen and progesterone, estrogen boosts serotonin and dopamine. So it's quite a stimulating hormone, kind of, energizing, uplifting hormone. And progesterone actually converts to what they call a neurosteroid, which is like a neurotransmitter called allopregnolone that is very similar to GABA. It interacts with called the GABA receptors in our brain. And GABA is the neurotransmitter that's our calming Valium neurotransmitter. It's the relaxing one. So yeah, it makes sense as the levels of estrogen actually go up during perimenopause, we can become overstimulated. And as the levels of progesterone go down, we can find it difficult to sleep, difficult to settle down, difficult to cope with stress as well as we used to.
Okay. Yeah, I think people might be surprised to know that you said that estrogen can spike to like, was it twice the average level? 3 times the average level. Tell us why this. So you said when estrogen spikes, you could feel more like wound up. Is that right?
Yeah, for sure. It can cause irritability and almost in some women kind of a rage type of feeling. That's part of it. It happens because I think it's actually just because our FSH is higher. That's our pituitary hormone that stimulates the ovaries. And so they're kind of whipping the ovaries to do more. And the result is more estrogen, but not a steady state of higher estrogen. I mean, that would be one thing. We could probably adapt to that, but it's a roller coaster. It's going up and down. It's spiking way up. And you get breast tenderness and, irritability, and then crashing all the way down to probably, to lower than we've had before. And that crashing down of estrogen is very unpleasant and can cause sort of depression, trigger migraines. That's where one of the reasons migraines come into the list. And that's where we can get hot flashes as well and night sweats. Even though we're still having periods, they're kind of different from the hot flashes that would come later in menopause. These ones are more from the estrogen crashing from high to low.
Okay. Yeah, I've definitely been noticing, I think I shared this on the podcast already, but I feel like I have a week of the month where I feel very depressed about my marriage. I feel very like unloved and like everything's bad. And then if I'll check my calendar, I'm like, oh, look at that. That's the time of the month it is again. So I'm trying to just manage that with like awareness, but also I'm doing some of the things you said in the book. You have some really great tips because of course we don't want to just talk about theory, although I could. But yeah, so I do use some topical progesterone, although as you said, like sometimes maybe it's not strong enough and you do need something orally. So talk about some of your favorite hacks for this estrogen spiking and the slow progesterone.
Yeah. So I call it the kind of rescue prescription for perimenopause, for mood specifically. The very first one is magnesium. And I love to give it with an amino acid called taurine. In Australia, I can get access to these great combination formulas that have the two nutrients. And together, they stabilize the GABA part of the brain. So that calming part of the brain that we're missing because we don't have the progesterone that we used to. So straight away, that can do a lot for PMS and sleep. And then that's number one. I give patients a month, maybe one cycle on that. If they're needing more, then natural progesterone comes next, because it is far better to look at taking progesterone during perimenopause than taking estrogen. And I've known this for a while. Professor Pryor, who helped me with the book, was really certain about that. She just said there is no reason to give a woman who is still menstruating estrogen, and that would include estrogen hormone replacement or the pill. She's like, it just doesn't sort of help in any way. So giving progesterone is the next stage. It can help with sleep. The cream is somewhat calming, but a natural progesterone capsule, which would be something like Prometrium, is sedating for sleep disturbance. It's like a sleeping pill.
Okay. So, and that's only prescription.
Yeah. I've had women say to me, it's like, okay, I just slept like I was a teenager, that sort of get into the world just out for 8 or 9 hours, which maybe they, hadn't been able to experience for a few years leading up to that. It's quite a relief when that happens.
Yeah, I interviewed another guest recently. I'm not sure whose show will come on first, so to speak.
Yeah.
She was saying that sleep is like the number one thing we need, a good night's sleep. And then it's it's going to help with mood and cravings and immune system and all that. So I think that's good news. And probably most people or many people in this age group are suffering from poor sleep. So that's really great. And then, I always recommend magnesium, and I've never taken the taurine. So I got to get in on that.
Yeah. I just blogged about it recently. And then I was finding all this, amazing research that's just quietly there in the background. You know how many, there's literally millions of studies out there. And if you happen to come across the right one, it's like, oh, there's actually a whole set of studies about using taurine to calm the nervous system, to help the brain, to prevent migraines. It's like, wow, these researchers have been just working on this for decades and we never knew about it.
Yeah, so people like you can spread the word. So taurine's an amino acid, and it helps. Does it help make GABA, or what does it do?
They actually, one of the papers I found said that taurine itself could probably be classified as a neurotransmitter, as a calming neurotransmitter, which is fascinating. It has a GABA-like effect. So they think it might interact with the GABA receptors, but they think it might just have its own receptors that they haven't discovered yet. So it's really interesting. It's an amino acid. It's one of what they call the non-essential amino acids, which so in theory, we should be able to synthesize it from some of the other essential amino acids, but in practice, we don't do that. So we really need to be getting it from food or from supplements. And I will say that taurine is only found in animal products. So this is particularly, point of interest for anyone out there who's vegetarian or vegan. I really recommend they look at a taurine supplement.
This is interesting too, because there's a couple other ones that vegetarians won't get. It's a thing, choline, right? An egg. B12 is obviously
and zinc is the other one I worry about. Vegetarians, because there is zinc in plant foods, but not a lot, so it's difficult.
It's in nuts, right? Some different nuts,
pumpkin seeds, and there's a little bit.
The
other thing with taurine is that taurine is depleted by estrogen. So you're already kind of running at a suboptimal level of taurine, and then you start getting these estrogen spikes, like I described. Potentially, you're even more depleted and need even more, which is one of the reasons why women actually need more taurine than men.
So it's only in animal products, depleted by estrogen. And I think you and I both know, like, even if you try to eat well, it's pretty easy to be deficient in different things. And so if you're feeling some of these symptoms, like you can't calm down or can't sleep. Another couple you mentioned that are sedative are magnolia and ziziphus. You want to talk about those?
They're just a couple of sleep herbs, and what they call anxiolytic anxiety reducing herbal medicines. They're often given together in combination formulas. I have access to similar formulas that I use in Australia that I use with my perimenopausal patients. So ziziphus it's a Chinese herb, but it's quite a common one quite a helpful one during perimenopause.
Okay. I like that one. Ashwagandha, you mentioned. Do you want to
stabilizes the HPA axis. Ashwagandha
Okay.
supports thyroid. Yeah.
Okay. Yeah, it's so interesting. This sounds like if we keep this HPA axis nourished during this changing time, then things won't be so erratic, eh?
It's a vulnerable time because are you still there?
Yeah, there's just a little gap.
Yeah, there's a tiny gap there. Sorry. I don't know. I was just saying the HPA axis is in a vulnerable time. It has to recalibrate while our female hormones are changing. So as long as we can just take extra care during these years in our 40s, then we know that that's going to happen. And because this is the other part of the story, is the mood symptoms, the sleep symptoms that women are experiencing in their 40s, they will not last. So what the research shows is that after periods stop in our 50s, for most of us, everything just settles down and we've got kind of a new normal, go back to, being able to cope with stress well and have, a good mood that we had before.
So you just have to ride it out.
Yeah.
Yeah, I think too. I was mentioning how I feel I get all weepy about my relationship, but then also like I'm making some big changes in my business and I was just like so wound up. Like I couldn't sleep and my heart was racing, which you mentioned in the chapter 2. And then like I can tell my period's about to start because everything's just dropped. Everything's just calmed down. My skin is calmed down. I'm not. And so I just have to kind of like reflect myself, and I'm saying this out loud so our listeners can as well, that sometimes you think it's situational and then you realize it's not. Not. It's just your hormones are really running you. So I think to have some of these things on hand, the adaptogens, magnesium, it's like, and there's other things too we haven't covered here. Hopefully people have found a few of their own favorites, so our listeners are pretty educated, but just really have those on hand and use them. I know for me, like around when my period comes, I really start thinking about my period, but it's really the whole month you have to pay attention.
Yeah.
Otherwise you get to the end and it's not easy. So you have to do those things every day.
The other good one is vitamin B6, because vitamin B6 also boosts GABA, helps to clear estrogen from the body. It's very stabilizing as well.
And this has to probably be in a dose beyond what comes in the multivitamin, eh?
Yeah. I really think, like with B6, I would look at least 30 milligrams.
Okay.
And anywhere up to 100 or 150 at the maximum. There is a maximum with B6. It's one of the few vitamins that can be toxic at higher dose. So I just want to read the label.
Yeah. That one can be used in pregnancy too for morning sickness. So it's a pretty cool one. And postpartum for, the same hormone imbalances are happening postpartum often, right? This low progesterone. So there's so many things I want to talk about. So since I mentioned pregnancy, there are definitely women in this age group, which is a range of age groups really, because we don't know when we'll hit our final menopause, but they're women certainly in their late 30s, early 40s, trying to get pregnant, and you addressed that and had a few tips for that. You want to share that?
Yeah. Well, it's about enhancing the quality of the ovarian follicles as much as possible at this point. I mean, the ovarian follicles, or the eggs, the growing eggs, have decreased their activity. There's no question about it, but you can support those. There's a couple of things I mentioned in the book. One is considering DHEA supplement. That's a natural hormone, but I think only if your DHEA is low. What the research shows that is DHEA can help to stimulate the development of ovarian follicles. So I know it's been used in some of the fertility clinics for the last 10 years or so. That's one idea. And the other one is coenzyme Q10, which helps to support mitochondria, which therefore supports the quality of the egg. So all my late 30 somethings patients who are trying for pregnancy, I think coenzyme Q10 really needs to be there for both the woman and the man, because sperm is similar. It has some similar nutritional requirements. Coenzyme Q10, zinc, selenium, those are all things that can help with the quality of egg and sperm.
Yeah, the antioxidants. And it's been interesting. When I was doing just fertility work, I knew about CoQ10, but I guess I hadn't frankly, I don't think I was using it a high enough dose. So I've been using it more recently just for cellular energy. And I'm like, I can tell I take it. It's one of the few things I can really tell. So I'll just kind of share what dose I'm doing. I don't know what you can see, tell me what you do. But I looked up the ubiquinol versus ubiquinone. My naturopath had put me on a mix of both. But as I look it up, it looks like more of the research was done on the ubiquinone, and it's cheaper, and it can be converted to ubiquinol. So I'm just taking ubiquinone now because can be very expensive, CoQ10.
Yeah.
So, but I found one, and I think we'll carry it in our shop later, that's 200 milligrams, which is a pretty strong dose, and then do that twice a day. And I'm telling you, you're going to feel some energy from that.
Yeah, 400 milligrams is it's a big dose. Yeah, I mean, I think it's fine to do. No, it's fine. I mean, it can be expensive, and I think it's fine. I've had some patients report that it can be a little bit stimulating at that level.
Okay.
But I mean, if you feel well, then
I guess it depends on your case. Yeah, I'm still trying to get this mold out of my body. I think for me, I needed it, but maybe it would be too much.
Well, even as you're talking, I'm thinking, maybe I should look at taking it again. It's one of those supplements that I've personally taken on and off, and then it kind of drops off the radar because it's,
do the high dose, see what happens.
Yeah. I might try it.
Maybe not at night.
Yeah. Exactly.
So another thing you mentioned earlier that women complain about in this age group, and they sometimes get put on birth control for or have a hysterectomy, is flooding or heavy periods. And let's talk about why that happens and how we can manage it.
Yeah, the crazy heavy periods of some women in our 40s. They can be, just to put it in perspective, it's normal to lose up to about 80 milliliters of menstrual fluid in a cycle, a few tablespoons kind of thing over the whole cycle. For some flooding periods, women can lose up to 500.
In one? Wow.
Compared to 80, just to give a perspective. I mean, if you have a few listeners out there for whom that's happened, they're going to be nodding they can,
wow, that's a lot.
At least kind of what some of your friends might have been going through. It's the kind of situation where you can't leave the bathroom. You're bleeding through your clothes, and it can be quite serious. And then, of course, there's a scale. So women can have periods that are still quite heavy, but not that bad. But still, it's bad enough that you end up in your doctor's rooms, and looking for something. Probably what most people are getting these days is Mirena IUD, the hormonal IUD, as a way to manage that. That's the conventional approach, which is better than the hysterectomy that they used to do 20 years ago routinely. So now there's a couple options. There's conventional options. There's the Mirena IUD. There's something called ablation, which sounds awful, but they cauterize the inside of the uterus. A topic on the Mirena, just a comment on the Mirena hormonal IUD. It's not progesterone. So it's a drug. It releases a drug called levonorgestrel, which does not have the beneficial effects on the HPA axis that I described for progesterone. It does lighten periods very much, lightens them by about 90%, but it potentially has side effects for mood because it's a progestin drug and not progesterone.
Oh, okay.
In fact, the Mirena IUD did quite badly in the birth control mood study that came out of Denmark late 2016. It was one of the worst ones.
Okay.
So if there might be women out there who cannot tolerate Mirena or another type of hormonal IUD, and so they need something else. And so what I offer in my book is my top 3 things for lightening periods. Number 1 is no dairy, no cow's dairy. I find that's quite consistent, that cutting dairy will lighten periods. Number 2 is turmeric, which lightens periods, but you have to take it all through the cycle. And number 3 is, again, the progesterone capsule, Prometrium, or a compounded, micronized, or natural progesterone, which lightens periods also quite a lot. Not as much as, say, Mirena, but quite substantially. And for most women, that's going to be enough. They would take it, they need a prescription from their doctor. They take it during the 2 weeks leading up to the period. Some women might need to take it every day through the month. That's depending on how bad their the bleeding is. So that's something they could talk to their doctor about. The Professor Pryor, Geraldine Pryor, who helped me with my book, she has her organization has called the Menstrual Research Center out of Canada. She has a document that she's made available online, which is prescribing progesterone for heavy periods for doctors. It's, you know, kind of a little prescribing document. So I can find that and link that, put that in the show notes.
Yeah,
so
we can hopefully dig that that up
yes,
also.
So,
okay. So
yeah.
I'm just so say a woman has gotten into this heavy period situation. Would she first do more basic things like, I don't know, yeah, you mentioned like avoid alcohol in this chapter, or
Yes.
lose weight, and okay. So we do those steps first, or?
Well, let's talk about that, because there may not be enough time to gradually do a few things. Like,
Okay.
in terms of if a woman's bleeding that heavily, its stakes are high. Like, she has to get it under control, or she's got a hysterectomy, or something like so.
Okay.
Unlike maybe some other milder symptoms where I definitely say, start with food, start with self-care, start with relaxation, I think with something like heavy periods, you want to make a pretty serious plan almost from the beginning. But in terms of lifestyle, the no dairy is the first one. And yeah, definitely cut back alcohol as well. Maintain a healthy gut microbiome or gut bacteria, because it's the job of the bacteria to clear estrogen from the body through the stool, through the bowel. So that's actually quite important. And there's a way you can enhance that, the bacteria doing that is with another supplement called calcium D-glucarate, which I mentioned in the book.
Yeah.
I have some of my patients lately tell me that's the thing that works the best to reduce estrogen, and also, lighten periods to some degree. Also relieve some of the high estrogen mood, irritability, breast tenderness symptoms that we mentioned. So
okay.
It's potentially.
I have taken that one before, but maybe I didn't take like strong enough or long enough. So
it's a pretty big dose. I'm forgetting the dose now off the top of my head.
I don't know if I wrote it down either.
It's okay. It's in the book.
Okay. Yeah. Well, speaking of the book, we're kind of focusing on this one chapter because I thought it might be interesting for my followers. But I'm curious, you mentioned like you increased the PCOS chapter and the endometriosis. If you're moving into this phase of life with a certain condition, what might you expect?
Yeah, it's good that I was just thinking before you asked that question that, there could be medical conditions that are playing a role in some of the symptoms that we experience with perimenopause. So for example, one would be endometriosis and its sister condition called adenomyosis. I expanded the adenomyosis section in the book. If your readers haven't heard of that before, it's quite a common condition of essentially enlarged uterus, heavy periods, painful periods that become more and more painful as you get older.
Okay.
And you can sometimes see that on ultrasound. So it's in the section of the book called How to Talk to Your Doctor. One of the questions I put there is just to ask your doctor outright, is like, do I have adenomyosis? Have I been tested for that? Because I've seen so many times actually with my own patients where I look at the ultrasound report that their doctor ordered for them, and it says right there they have adenomyosis, and the doctor never mentioned it. The doctor just kind of said, oh, we're going to use the IUD, that's the treatment. They never kind of took this extra step to explain there's this other inflammatory condition of the uterus happening, which is a big part of why your periods are so heavy. So, and then from that's important from a natural perspective, because then that informs, what treatments you might choose.
Okay. And
For that.
am I remembering correctly that's like abnormal growth within the uterine lining?
Yeah.
Okay.
Yeah. So
Okay.
it's similar to endometriosis, is tissue that is like the uterine lining that is growing anywhere really, but
Elsewhere. Okay.
like throughout the pelvis. Adenomyosis is where that uterine lining tissue is growing up into the muscle wall of the uterus, and
Okay.
it can cause quite a lot of pain actually. So if you're 45, your late 40s, it's like, wow, my periods have never been as painful as this. It's probably time to have an ultrasound.
Okay. And how about in cases of endometriosis? How might those change with time?
Yeah, it can go either way. It can continue to sort of just get worse and worse. Certainly, I've had women in their late 40s whose endometriosis is worse than ever. So that disease can take different paths.
Okay. But maybe if for some reason they sort of have low hormone levels, could it be milder?
Yeah, well, eventually after menopause, when hormones stop, those hormone dependent conditions should improve or mostly disappear. But endometriosis is made worse by estrogen. And I just said that during perimenopause, during our 40s, estrogen can spike up to 3 times higher than ever before. So you can imagine what kind of effect that might have on endometriosis. And also the loss of progesterone is not good news for endometriosis, because progesterone has a normally suppressive effect on the disease.
Okay. Yeah, that makes sense. So I think one disease that can get better is PCOS with age, right?
Yeah, well, certainly with the PCOS picture, with the irregular cycles, for example, the long cycles, what the research shows and what I've certainly seen with my patients is that tends to correct itself, because our cycles shorten as we get older anyway. So yeah, we know that can happen. But that said, the insulin resistant part of PCOS, that underlying metabolic syndrome or insulin resistance, doesn't go away with age. It only goes away with treatment, which is removing sugar and dietary treatment. So that's just one caution for anyone with a history of PCOS moving into menopause. It's like the condition doesn't go away when your periods stop. If anything, the underlying insulin resistance can actually get worse with menopause.
Okay, that was a good correction.
Yeah.
So you might notice less period symptoms. I know you can actually get more fertile even, but then you're getting into that age group where you're more prone to heart disease and cancers and that kind of a thing.
Exactly.
Okay. Yeah, unfortunately, there's like getting older isn't the funnest thing.
It's not for sissies.
The only reason we keep going is life is worth it.
Yeah, for sure.
But yeah, it's definitely, there's more to manage. And, I'm sure like I have a lot of really healthy habits, but, it still doesn't seem to be quite enough sometimes
It's true. I keep piling on. It's like, okay, I do yoga. Okay, now I meditate. Now I just keep sort of, okay, now I'm working less. I just have to.
I saw that in your book. You suggested you could work less or get a housekeeper. And I thought, that's really, it's funny, but true. It's like, and I think women do often feel really frazzled in this age group. They're not getting a good night's sleep and they're working, they have a lot to do. So I think it is a good point. What we're dealing with is not for sissies, like you said.
Well, and the thing that might help if someone's thinking, oh gosh, I can't afford a housekeeper, or it's not forever. You could think of it as an investment for these next few years, just to kind of bridge this vulnerable time, and then you get to the other end, and then you should find your energy and everything bounces back, and you're good. So
that's a good point.
Yeah.
Well, maybe I'll mention, let's see. I want to talk about a couple of other things I made a note of, and then we'll talk more about your resources. This was interesting. You said when you're in estrogen dominance, you can have histamine intolerance more. So you could be stuffy nose or asthma. I remember a patient I had who was getting asthma with perimenopause, and I could not explain it at the time until right now.
Yeah.
So I think our listeners might not be too much aware of histamine intolerance. Tell us about that.
Yeah. So it's the allergic type feeling that comes with an exposure to allergy. Our immune system releases a chemical, or a neurotransmitter kind of hormone called histamine, which is actually a fascinating hormone because it can cause hives and itching and redness and stuffy nose and headaches and that kind of allergy symptom. But it's also a neurotransmitter. It can cause insomnia, anxiety, causes a lot of symptoms that look and feel like PMS. So I do think that histamine plays a role in PMS. Histamine is also involved in ovarian function, which is just fascinating, this intersection with female health. So I have a blog post called The Curious, what do they call it? The Curious Connection or something with estrogen and histamine intolerance. And it's that histamine causes the ovaries to make more estrogen, and estrogen causes the body-wide release of more histamine. So it becomes a feed-forward little.
So histamine creates
storm.
Estrogen production?
Yep. So histamine stimulates more estrogen production at the ovaries, and estrogen stimulates more histamine production by the immune system. So it's kind of a runaway train during estrogen dominance. But there are some brakes we can put on it. So one of the brakes for histamine is progesterone, which I think is one of the reasons that another reason that it works so well and it feels so calming is that it helps to lower histamine. And another good one is vitamin B6, which I mentioned before, which helps the body to clear histamine. And the other thing is to look at reducing foods, histamine containing foods and histamine stimulating foods. So the big one is dairy. So again, we come back to dairy. And in some women can be quite, stimulate a lot of quite allergic type symptoms, stimulate more estrogen potentially. And then some of the other histamine containing foods are all the fermented, like all the sauerkrauts and the bone broths and all these, really kind of rich foods. In someone who's already suffering symptoms of histamine intolerance, those foods can be quite aggravating and can worsen insomnia.
Okay. Are sugar or chocolate in that group?
Chocolate is. Sugar is not involved in the histamine story specifically, although sugar has its own set of problems, definitely. So I think.
What about like wine?
Yeah, red wine. Red wine's the classic one.
Okay.
So this is what the people who get nasally congested from red wine, that's histamine. The histamine's in the red wine. Histamine, that's why red wine can worsen headaches, migraines.
Okay. So part of the thing people have to do when I listen to this podcast is listen to my health problems. So I want to share another one. So I've been experimenting with essential oils. The guests we're having around the same time as Jody Cohen, who has an essential oils company. I've been reading her book, and she talked about histamines, and it was like a huge light bulb went off for me, because ever since I've had this mold situation, where I've also been in my 40s, I have this little tiny bit of mucus that it's not like I cough things up, but it's like I feel a little asthmatic, or I have a little in the back of my throat, and I don't eat dairy. It's like nothing really stimulating a lot of phlegm, but it's just sort of around. To the one time I ended up in the urgent care because I just was like, I can't breathe and this isn't normal. So she was explaining how it's like the mucous membranes are releasing an inflammatory response, which I'm sure has its place doing something. I probably
infection.
Yeah, and for me, I think it's irritated by the mold and maybe chronic virus, and I deal with. So I just couldn't figure out what was going on or how to deal with it, because I had never heard about it in a mold conversation. So I read that and I was like, huh? So I started using this histamine oil she had, and along with a lymph oil she has. And the first time I took that, it was like, it's like I had my first deep breath. in 2 years. It was amazing. So then I read your bit about histamine, and I was like, even more is getting put together that, this kind of maybe is explaining some things about my mood, or, yeah, I am like I mean, I can barely have like a nib of chocolate without it making my throat swell up.
Okay.
So I think just right now I'm going through a histamine phase,
Well, and you're
and
more vulnerable because you're in perimenopause.
exactly. Yeah.
Yes. But the mold's gone now, right? Like you're not exposed.
No. I mean, it's not exposed, but it's still in my tissues in certain places.
Yeah.
Like I had my
Yeah.
nose tested and it's still there. Yeah, I was joking with my husband like just this morning because I'm having him do the oils too. And he's like, I don't really notice anything. And I'm like, you don't? I'm like, that's because you're not as sick as me. Like, this is much harder for me than you. We were both exposed to mold, but he's younger than me. And it's just like, it doesn't manifest in so many myriad ways for him as it does for me. And yeah, I'm just sharing this because, again, going back to like this age is not easy. And there's so many complicated aspects. But it sounds like we all just need to slap on some progesterone, take some magnesium.
Progesterone will fix everything. So it is true that the perimenopausal allergies or perimenopausal immune changes, quite common. And yeah, for years of my own practice with patients, I didn't quite understand it either. And then, when I started reading about histamine, understanding about histamine, the penny dropped. It's like, okay, that makes sense. Yeah, the immune system's going through some big destabilizing changes.
Well, tell me more about that. Tell me a little deeper. So this histamine is a part of the immune reaction.
Yeah, it's definitely a key part of the immune reaction. So that would lead to acute allergy type symptoms. Yeah, it could drive things like asthma as well. So there's histamine involved, with which both estrogen and progesterone influence histamine. But then the hormones themselves have direct effects on the immune system as well. So for example, progesterone helps to prevent autoimmune disease. So it's not unusual in our 40s when we lose progesterone to get a flare of something like Hashimoto's or autoimmune thyroid. And I think a big part of it is losing progesterone's normally kind of stabilizing effect on the immune system.
Oh, okay. Yeah. Go ahead.
In the book, I have a section in chapter 10 called, is it perimenopause or thyroid or both? Because this is often a time when Hashimoto's would flare up as well.
That happened to me too. Like when I turned around 41, I had my first little antibodies. They're luckily not too crazy. And those, luckily I have an attitude like that will chill out when everything else chills out.
Yeah.
So yeah, I don't get too wrapped up in that diagnosis. Yeah, you said 26% of people in perimenopause, women in perimenopause, have autoimmune thyroid. That's really high.
I know. 1 in 4.
1 in 4. Yeah. Yeah. We often kind of joke. It's not really a joke, but we kind of joke, my health coach and I, like, it's thyroid, sex hormones, and gut. Like that's what we're dealing with all day long.
Yeah, for sure.
I'm sure you are too. So let's talk more about your resources. Actually, before I ask you about them, I just want to give a shout out for the book, because it's like a little Bible you should have for women's health. And many people listening now, have daughters, and they're wondering, they're wanting to do a good job, which I really admire. They're wanting to give their daughters more direction than they had. So it can be a great, thing to have as your daughter is starting her period or having some symptoms and you wonder what it is. What are some other ways people use this, Lara?
Well, it's a way off hormonal birth control. It's a way to not have to take it. So speaking of daughters, probably one of the, I'll say one of the best things you can do for your daughters out there is help them to stay off hormonal birth control. Find another way, because I want to share something about that I learned from Professor Pryor about teenagers. So it takes 12 years to mature the female hormonal system. So that is for the communication between the brain and the ovaries and the making of progesterone and everything, fertility, everything the hormonal system is doing, takes 12 years to mature. So if a girl gets her period at 13, she will not kind of be fully hormonally vital until she's 25.
Oh,
And
wow.
when I heard Professor Pryor talk about that, the interviewer asked her, well, what happens if you put a 14-year-old on the pill? She's like, that whole process is stalled.
Oh,
And that
wow.
would then have to resume when she comes off the pill. So that's why you see women in their late 20s, early 30s coming off the pill, cannot get the period going because they have not, their body hasn't learned to ovulate. Basically, you can't just go from zero to full ovulation. You know, it makes sense. You know, it takes a while. I talk about in my book the hormonal river system. It takes a while to kind of get that signaling happening. And
Wow.
you really don't want to shut that down, even if, you know, even in a scenario where, I don't know, you know, future fertility is not an issue, which I don't know who would be thinking that, but, you know, because it's always potentially something that a woman's going to maybe want, but we make ovulation and hormonal maturity is not just for making babies. It's also for bone health, you know, brain health, all the amazing things that our female hormones do for us. And there are no female hormones in the pill. I mean, if you will, like they're drug analogs of our own hormones. They're not the same molecules. They do not have the same benefits on general health. For example, we know that the pill prevents women from reaching their peak bone density, and that's because there's no progesterone in the pill. So that's why I had to get in a little pill rant, of course. You asked me about teen, so
Yeah, that's a great one. Thank you for taking that one over. Yeah, I'm very passionate about helping, you know, our next generation do things differently than we did. I was certainly offered the pill really early. Luckily, I didn't tolerate it well, so I didn't stay on it. Thank God, because pretty much everyone's offered the pill as soon as they have cramps or acne
or skin. I know. And
mm-hmm.
Those girls cannot say no. Like they don't have, a 14-year-old is, to be fair, is not going to have enough kind of wherewithal to probably say no to that. So I think this is about our whole generation, us becoming informed and helping them.
Absolutely. Absolutely. You can't expect a 13-year-old to like navigate all that on her own. Yeah. It's interesting when you say that the maturity of the system isn't there and then they get off the pill and they can't get their period, which we know about, but then also like, do you know Andrea Thorpe? Do you know her?
No.
I have to introduce you to, because she was on the show a long time ago talking about what happens when we get off the pill and how we see so much autoimmunity and like why that autoimmunity could be coming up. But here you're saying in perimenopause we could be having autoimmunity, and then these women coming off the pill and say when she's 35 or 30, it's like a puberty / perimenopause scenario for her because things are so unstable. It's like, yeah, this was huge for me that you shared. It takes 12 years.
Yeah, it was huge for me. I remember remember exactly where I was sitting when I heard Professor Pryor say that in the podcast. I was up getting my hair done. I was just like, I kind of grabbed the table. I was like, oh my God, that makes so much sense.
No, I figured, I mean, I don't know, I would say 3 to 5 years is maybe what I thought, you know. I knew there was some instability, and I remember from my own early years how unstable it was. The 12 years, that's a long time.
It is.
Oh, wow. So yeah, obviously there's a lot of nuggets in this book. It's just a great reference book to have. Certainly if you're a practitioner, you should own this book. Like, I'm just going to say it, because where else are you going to get all this? And then you can look it up. Like, you know, we have all these podcasts and it's great, but where are you going to go when you have a patient who needs you? You gotta have the book.
Yeah.
And you're a great writer. Like you said, you're a prolific blogger. Do you want to share your site and what you got going on there?
Yeah, thanks, Bridget. So my site is larabriden.com. Lara Briden, the period revolutionary, is my new handle. And I'm on social media at Lara Briden, Twitter, Facebook, Instagram. And my book is Period Repair Manual.
And that's on Amazon and everywhere? Okay.
Yeah, iTunes, Amazon.
Oh, it's an audiobook?
No, iTunes, the iBook. Yeah, the iBook.
Oh, okay. Okay. I'm out of that.
I just mentioned it because actually the iBook version is quite a nice version. If anyone just wants to put it on their iPad, it's a nice it's all hyperlinked and it's quite easy to
Oh,
navigate.
interesting. Is it a Kindle book too?
Yep.
Okay. Okay. Great. Well, thanks again, Lara. We really appreciate you coming back on.
Thank you so much, Bridget. It was great to talk to you.
Yeah, you as well.